find a good concussion doctor? The first thing I always tell people is to go to this directory. If you type in impact, find a concussion doctor, and you scroll down past the ads, you see this, find a concussion care provider impact applications. If you click on that, it'll take you to a directory where you can type in the name or the zip code of your city, and it will bring up a list. So for this video, I typed in a place I knew nothing about, Tyler, Texas. Never been there, don't know anything about it. And I clicked off this tab, Concussion Care in Person, hit update, and up came a list of different concussion specialists. And you can see that it tells me how far away they are from Tyler, Texas, anywhere from somebody who's apparently right in town all the way to ones in the city about an hour and a half away here. So how do I begin to filter through these and make some choices about where to go? Well, if you have my book, Goodbye Concussion, you know that it has a page in it where I give you a little checklist of what I would be looking for if I was trying to find a doctor for my concussion or my kid's concussion outside of the Pittsburgh area. Of course, if I was in the Pittsburgh area, I would go to Dr. Collins at the UPMC Concussion Clinic. But let's say we're in Tyler, Texas and can't get to Pittsburgh. What are we looking for? Well, we're first of all looking for someone who's giving active treatments, not rest. If a website that you go to is talking about how important it is to rest, then, keep looking. The next thing I'd be looking for is an understanding of 6 different types of concussion, not a one-size-fits-all approach. So that the doctor is looking for these 6 different areas: vestibular, ocular, anxiety, migraine, cognitive, and neck issues. That the place you go is going to be looking for and willing to address your individual problems with any of those areas. Next, we're looking for an exposure recovery model of treatment, where we're not just getting sent off somewhere to rest. They're exposing you to the things that are giving you symptoms and teaching your brain to readapt to those things and to accept them and be able to do them again. Next one is multidisciplinary care. That means that there is a team of people treating you, ideally, not just one person, but a team of experts. And finally, and very importantly, that the place has an attitude of hope and agency. So if the website's talking about how scary and permanent damage concussions cause and people never get better, I've seen a lot of websites that supposedly give care but talk in a way that is like that. I would never go to a place like that. You want a place that has the tools and the confidence to help you get better and give you hope so that you can get better. And by agency, I mean that they are giving you control, they're giving you exercises and things that you can do, lifestyle changes, not giving you a hopelessness, but giving you control back of your life and your injury. So back to Tyler, Texas, and the different places here that we could check out. I picked 3 to check out, and the first one I looked at here was a neuropsychologist, and I don't know anything about this person, but apparently he's just a psychologist. Not just as in that's a bad thing, but that's what he does, and he's not offering these other kinds of therapies. Presumably, maybe he'd send you out to these other, vestibular, ocular therapies, but that's not part of what's in his office. So I'd probably keep looking and see if there's something different. I found this one, integrative concussion therapy. Again, I don't know anything about these people, but just looking at their website, we see it sounds hopeful. We help relieve symptoms, recover functionality, and return patients to activity. That's a great attitude. I like that attitude. They don't have a whole lot of specific information. They talk about doing manual therapy, and they talk about doing vestibular and ocular kinds of therapies and physical therapies. So this place looks pretty good. The one thing I'd say that maybe they might be missing is dealing with anxiety. I didn't see any neuropsychologist on the team or them really addressing that issue, which is a common issue in concussion. So that could be a missing piece from these people's program. And the final place I looked at was here at the University of Texas Southwestern. And they, excuse me, they the first thing on their sentence I see here is our multidisciplinary concussion program. So right off the bat, I think, yes, that's one thing I'm definitely looking for. Comprehensive patient care. They talk about, I don't see anything on here about resting. This all looks very active. Many different spheres that I talk about. Neurooptometry, that's with your eyes. They have a psychology team that's great to help with anxiety and mood issues. Aerobic exercises, that's excellent. We're not resting, we're actively treating this. This was a large place. If I was making a choice, this would be my first choice, just on a quick cursory look. Again, this is not an official endorsement. I don't know these people, but on a quick 5-minute search, this is where I would land for my first choice of where to go for my concussion if I was in Tyler, Texas. Finally, let me say that you do need to get help ASAP if you have a concussion. Studies show that people seen within the first 7 to 10 days recover twice as fast as people who wait. So don't wait around. Find a place that can take you right away too. If you call and they have a 3-month, 6-month wait, you got to move on. You got to find some place that can take you right away. So I hope you enjoyed this little talk. I hope it's super helpful to you, and I hope that you can find a good concussion doctor right away. Goodbye.